Welcome and thank you for joining. My name is Angelica and I am a health educator for community health at Atlantic Health System. Today's webinar, Be Ready to Be Fast, is presented by Lori Coons, Stroke Program Manager at Hackettstown Medical Center.
Hi, guys.
Before we begin, I have a few announcements. This webinar is being recorded and all participants are muted. If you have questions, please use the Q&A for questions or the chat for comments. You'll see the two icons in your toolbar. We will try our best to get through all the questions at the end of the program. At Atlantic Health System, we are encouraging everyone to be an active partner in their healthcare. We recommend using an online tool called MyChart to help you manage your care. MyChart is an interactive tool that gives you 24/7 access to your electronic medical record. Anyone who is a patient with Atlantic Health System can open the MyChart account. It includes anyone who has visited Atlantic Health System providers for routine visits, vaccine visits, or an Atlantic Health System emergency room visit. If you're not an Atlantic Health System patient, you may have access to your own MyChart or a similar platform through your own provider. MyChart allows you to manage many aspects of your healthcare. Some of the most popular features allow you to request your medical records, view medical information such as your test results and medications, send non-urgent messages to your provider's office or request medication refills, view clinical notes or after visit summaries, schedule appointments online, do an e-check-in for your appointments, which makes the check-in and rooming go much faster. It also includes the ability to e-sign certain documents. It also allows you to pay for your hospital bills online and you have the option to share your MyChart with family, friends, and vice versa. For example, you can get access to your child's MyChart so you can manage the whole family from one account, or senior parents can give access to their adult children. There are many more features available to help you manage your care. If you want support with setting up a MyChart account, you can log in and help is available 24 hours a day, 7 days a week. Here's the phone number to call if you need assistance, and you can scan this QR code for more information.
Okay. See if my little buttons are working. Have a little delay here. There we go. Okay, we are ready to go. So as you know, we're talking about being ready for BeFast, which is a way to identify somebody who could potentially be having a stroke. So in order to do that, we're going to talk a little bit about stroke facts. We'll talk a little bit about the different types of strokes that can occur, and most importantly, the risk factors for those that put us higher at risk for stroke and what we can do about it. And with that, I just want to keep you, abreast. Like the fourth largest killer for the United States is in fact stroke. So that means that 1 out of every 20 deaths is related to a stroke. Now, with that, doesn't seem like that many, but what's most important is that stroke is the leading cause of serious or long-term disability. So it's a huge impact on us, whether it's our family direct, our neighbors, or our community. Of course, stroke costs estimate us in the United States about $34 billion every year. So that's huge. So when we look at stroke, we have to keep in mind there's different types of strokes. About 87% of strokes are actually caused by a blockage, what we call an ischemic stroke. When the blood flow to the brain has been blocked by a clot, either a thrombus, a stationary clot, or an embolus, which is a traveling clot that goes through a vessel in the brain. The other 13% are usually bleed related. So we can talk a little bit about those. Oh, my arrows are not working well. Here we go. Okay. So who's at risk? Well, there are some risks that we have that we can't change, some that we can change, but inherently there are some, excuse me, incidences where African Americans are almost double that of Caucasians, and they're twice as likely to die from a stroke than Caucasians. So that's very alarming. So we really want to target those audiences and try to increase their awareness of risk factors and how to lessen the risk, because obviously we can't change our race or ethnicity, but we can certainly change the risks that are part of that would make us more likely. Women have an increased risk for hemorrhagic strokes and even for ischemic strokes. Women prior to menopause have a lesser risk, but as soon as we hit menopause, we catch up with our risk for ischemic strokes. American Indians, Alaska Natives, and African Americans are more likely to have a stroke than the other ethnic groups, and Asians are at a higher risk for hemorrhagic strokes. So we'll go into the different risks for the hemorrhagic and ischemic strokes that would help us to hopefully fend off the risk for stroke from those things that we can control. So as I mentioned, men are more likely than women to have strokes until menopause, and then we catch up. However, women are more likely to die from strokes. So if you look at that, a lot of times women will wait longer to seek medical attention, and that goes for heart attack and strokes. So we really want to encourage women who often present not quite the clinical face droop, weakness on one side. Sometimes their signs and symptoms are a little bit more abstract. So we really want to increase the awareness so that people will get help earlier, and then that will help to lessen the deaths and the severe disabilities that we do see from strokes. And greater than 58% of Americans don't know that they're at risk for stroke. So that's why it's so important that we continue to share this particular presentation and this information with our audiences, because you may pick up on somebody having a stroke where they may not actually be aware of it. Okay, so what is a stroke? First of all, we need to recognize that stroke is a medical emergency. Stroke is very much a medical emergency. And if we think about it, we're used to hearing heart attack. Well, if we think about it as a brain attack, that's what we want you to think of, because it is time sensitive. Neurons are dying in your brain every second, every minute, and we want to prevent that damage from expanding. We want to minimize the damage as it's taking place. So when brain cells die, we call that an infarction, similar to a myocardial infarction, which is the heart attack. It will be a brain infarction from lack of oxygen and blood flow to that area of the brain. So if you look at the pictures that you see there on the screen, that red area, such as the hemorrhagic area, that's bleeding in the brain. And as you know, there is very little room in our brain for extra fluid. So as we're bleeding, it starts to squish that brain tissue, which of course does not allow it to be perfused or to have that blood circulating as it's supposed to. And the area that would be supplied by that blood vessel is now being starved. So that area will cause damage and will create that infarcted area. And it'll also put pressure on the brain, so the brain will actually start to move to the other side because there's so much pressure pushing that brain. The ischemic stroke is the gray area, that picture with the gray area that we see. And that works similarly in that the blockage occurs and does not allow that area past that point to be fed with blood and oxygen. And that will cause a starvation of sort for that brain tissue, which of course then causes that infarction to occur. So what's important to realize is time is important, and we can reverse some of that for the ischemic stroke or minimize damage if we can get treatment rapidly. Now, the hemorrhagic stroke would not be available to the same type of treatment, but rapid treatment, of course, is another concern. So oh, I'm sorry. I was listening to a code overhead to make sure it wasn't a code stroke. I apologize for the distraction. So what we look at with these two is that any damage to the brain in the form of a stroke, whether it's a hemorrhagic stroke, meaning a bleed, or an ischemic stroke, meaning a blockage, there are different treatments available, but the most important thing is for us to realize that time is important, and every minute that we wait, brain cells are lost. Okay, so there are different types of strokes, as we mentioned. The ischemic stroke is a lack of oxygen in blood due to a clot or a blockage, and a hemorrhagic stroke is a brain bleed. But what is a TIA? So a TIA is what we refer to as a transient ischemic attack. So that means that there's something that is temporarily blocking the blood flow to a portion of the brain. Now, we call it transient or temporary because it usually resolves. Now, we say within an hour or two, but technically up to 24 hours. If it actually resolved, then we can call it a transient ischemic attack or a TIA. Now, if you experience signs or symptoms of a stroke, which we'll get to in just a moment, what's really important to know is that we never assume it's a TIA. We never assume it's going to resolve quickly. We're going to assume it is a stroke until we prove otherwise. And what's important with that is if it is in fact a stroke and we need to do an intervention or a treatment, we can do that timely. And we want to do that very quickly. If it is a TIA, because the symptoms resolve by the time you get to the emergency room or in the emergency room, that is great. We are happy to see that, but we are still going to treat you as a stroke patient and make sure we can find out what your risks are, what we can do to help you reduce your risk for having another event or a more serious event. So a TIA is generally a warning sign of something that could be coming more severe. And that's why we're going to treat you as a stroke patient. We're going to admit you, we're going to monitor you, we're going to do some tests, and we're going to try to figure out how we can help you to lessen your risk of having that next event. So what are your risk factors? Everybody has a little bit different, but there are some that are very common and very dangerous for us for having the risk. So high blood pressure. You may know that high blood pressure is known as the silent killer. Okay, now I would ask you to tell me why, but I can't see your hands and you can't talk to me, so I'll let you know. So the silent killer of high blood pressure is because we often don't know we have high blood pressure. It is the major risk factor for a hemorrhagic stroke. So uncontrolled high blood pressure allows the pressure and the damage to the vessels, the blood vessels throughout your entire body, actually. But we're most concerned with those going to the heart and the brain because high blood pressure will damage those vessels and it will put you more at risk for heart attack and stroke. So we don't want that. We want to manage our blood pressure. We don't often know that it's high unless we have headaches, we feel very anxious, we feel, a lot of pressure in our head. But that's often not going to be an early warning sign. That's going to be during a hypertensive crisis or when your blood pressure is really high. So you may feel it more so times of stress or with, heavy activity or exertion. But the reality is you don't realize that your blood pressure is high when you're not doing that. So it's important to have your blood pressure checked regularly. If you have a family history of high blood pressure, you might want to go at least every 6 months and have your blood pressure evaluated. If you don't have a family history or concerns for high blood pressure, then your annual checkups may be enough. But if you do have any other risk factors that we'll talk about or any concerns, it might be important to monitor your blood pressure at home. And with that, I don't mean checking it 6 times a day because that's not healthy for anybody, but checking it occasionally, at the same time of day and see if there's a pattern, see if you're elevated, when you wake up in the morning or you're elevated before you go to bed at night. And those are some things that we would want to look at because lifestyle changes are the first thing we're going to try to do to lower your blood pressure. Nobody wants to be on medication if you don't need it. But if you've tried the lifestyle changes such as, exercise, proper rest, eating better, staying hydrated, those things, then if they don't work or if that's not enough, or if your blood pressure is so high, then we will go to medications and the recommendations for medication to control that. What's important to realize is controlled blood pressure will lessen your risk for sure. Okay, so controlled blood pressure will reduce the inflammation, the aggravation, and the stress on those blood vessels, which will then lessen your risk for heart attack and stroke. So that's what we really want to focus on. Now, this time of year, we also want to make sure we talk a lot about dehydration because dehydration can cause an imbalance of fluids and electrolytes in your body as you sweat, right? You're sweating out all that fluid, and then you have a higher concentration of those electrolytes in your blood, and they need to be hydrated and flushed out, or else it will start to cause an imbalance for your body. So, we want to make sure we stay hydrated. Your blood volume decreases as you lose fluids and you're sweating out. Obviously, that water comes from your body and your system. So your blood volume is going to decrease and your blood pressure will decline because you've got less volume. That also means the blood that's in there is going to be a little bit thicker, kind of. So you don't have as much, water in that blood to thin it out a little bit. So that will make you more at risk for things like clotting and so forth. So with the blood pressure decline, with the blood volume decline, your blood flow to the brain is going to decline or decrease as well. So with that, we need to keep in mind stroke patients who arrive dehydrated or remain dehydrated often have worse outcomes. Well, that just makes sense, right? If the blood is not perfusing and feeding the brain as it should, then it's not going to get what it needs. So hydration is very important. And while summer is a highlighted time that we talk about dehydration, it can actually occur all year long. If you have an elderly person that you are caring for or you live with, or if you are one of those elderly people, let's face it, we all know nobody wants to get up and pee 6 times at night, right? So what do? We stop drinking before we go to bed. Well, that's not necessarily the best thing that we should do. We really need to stay hydrated. And even during the day, it can be uncomfortable if you have to get up and you have to, go to the bathroom multiple times. However, it's really important that we do that. And it's important to know how much water we should be drinking every day. So based on your particular needs, you should talk to your doctor and see, 8 ounce glasses a day is the usual, right? Well, that's a lot of water, but some people need more than that. Some people not quite as much, but it's important to know that drinking water is very important. And again, back to the dehydration and blood clots. Dehydration can cause the blood flow to become sluggish, which then, of course, makes it a little bit more risky to develop some clots. We also talk about while traveling. When you stay in one place for a long time, or you don't want to pee on an airplane or on a train or on a bus, right? What do? We don't drink. That's going to be a dangerous risk for us. So we'll talk about that a little bit more as well. Dehydration is a major risk factor for blood clots, also caffeine and alcohol. Well, it's the summertime. I want to stay awake and I want to have my fun and I want to go on vacation and have a few drinks. Well, yeah, so I'm going to drink a little more caffeine and alcohol this time of year, maybe. And that is what we want to keep in mind. You don't want to increase your caffeine and alcohol and decrease your water because it's all going to add up and it's going to increase our risk. We also have contributing factors such as stress, fear, and panic attacks that can contribute to blood clots. So all of those things, if you take any one individually, it's not a big risk, but when you start to add them all together, it makes you definitely more at risk for forming blood clots. And of course, a blood clot can then travel to the brain and of course, cause a stroke. So some other things that can make the risk for blood clots even worse: obesity, pregnancy, sitting for extended periods, smoking, oral contraceptives, if you've had a recent injury or recent surgery. As we get a little bit older, that's age over 60. Forgive my typo, I'm so sorry. Age over 60 and any family history of blood clots. So if we take a risk of dehydration or excessive alcohol or caffeine, and we add in the fact that we're smoking and we use oral contraceptives, well, my goodness, you are just a stroke waiting to happen with those blood clots. So we just want to bring that to your awareness and make sure that you guys understand these will increase your risk. So with air travel and stroke, this time of year, we like to sneak away for a little vacation. Angelica and I were just talking earlier about upcoming vacations, and 2% of all in-flight emergencies are stroke. So that doesn't happen very often, as you can see. It's one stroke in every 35,000 flights. So it's not a big concern, right? However, what we do need to keep in mind is that most are based on clots. a clot forming somewhere in the body and traveling to the brain. So again, just because it doesn't happen during the flight doesn't mean it won't happen after the flight. Because again, we're forming those clots. We're not drinking really well because we don't want to have to get up and interrupt the flight, and use the bathroom every 20 minutes. But we do need to stay very much hydrated, especially during travel this time of year. Now, this is the one handout that I have added into everybody because this time of year we get an awful lot of questions about heat stroke versus stroke. So this is a handout that we're sending out to you guys. And I just want to point out the differences between a heat stroke and a stroke. A heat stroke, honestly, is going to be fatal about 50% of the time. And that's according to the statistics from the National Safety Council. So when we look at that, that's pretty darn dangerous. However, there's a lot of warning signs that lead up to a heat stroke that we need to pay attention to. So what happens before we have an all full out heat stroke, we have heat exhaustion or heat cramps. The body starts to tell you when it's in trouble, okay? So when the body's getting overheated, we start sweating a lot. We lose that water because sweating is the way the body helps to cool down, and it's trying to compensate for the overheatedness. So we sweat and we try to cool ourselves off. Well, if we don't replenish that and we don't get the water in, then we're going to have that electrolyte imbalance that can occur. So the body will start to recognize, I don't feel well, I'm nauseous, maybe some cramping will occur, and the body is just telling you, I'm overheated, I need more than what you're able to do for me. So what should we do? We should get out of the heat, get into a cool area. We want to cool down. If they're a little nauseous, or if we're feeling nauseous, try to drink a little something. But if you're vomiting, then you really need to get to the hospital. So you're going to call for 911. What happens when that progresses? If we didn't listen to our bodies, we weren't able to hydrate, get out of the heat, your body temperature will continue to increase, and up to about 104, that's when our heat stroke is starting to overwhelm the body. Now, we're no longer sweating because we've exhausted our ability to try to compensate for being overheated. All right. So now, instead of being hot and sweaty and slimy, now we're getting very dry skin. We're getting bright red. The heat is just overcoming. And that's going to be the body's last ditch effort to compensate for this. We're no longer able to sweat. We can't cool our body temperature down. This is when we're going to start to be confused. We might get a headache. The skin is going to be hot and dry. The heart rate is racing. Okay, we've got a really fast heart rate. We might lose consciousness, could feel sick to our stomach, and the breathing can become rapid and shallow because we're trying to make our body better, and we're trying to get rid of those waste products that we can't sweat out anymore. And that's going to be a sign that we're really in trouble. So when somebody is experiencing a little confusion, nausea, headache, and they're bright red, they've been outside or they've been in a heated environment, we might suspect heat stroke. And that is a true medical emergency. Okay. Now, having just described all of that for heat stroke, when we look at regular stroke, not heat related, that's again that blockage to the brain or the blood vessel or a rupture. So with that, they may present with confusion, headache, they might be nauseous, they might be vomiting, they might lose consciousness, their breathing could be different. So there are a lot of those similarities, right? So what we need to do is we need to actually take it a step further. And we say we're going to use the FAST acronym. We're actually going to get a little further into that and call it BFAST. And we're going to try to recognize the difference between the heat stroke signs and symptoms as well as the regular stroke signs and symptoms. So how do we do that? We are going to look, well, actually, we'll come back to the coronary artery disease and AFib. Okay, I want to get to my BFAST. Where's my BFAST? The BFAST is going to be the acronym that we are going to use for recognizing the signs and symptoms of a stroke. So the BFAST includes balance issues, any, inability, that means dizziness, they don't feel steady on their feet, they're wobbly, okay? That's a balance issue, and we need to realize that could be the brain that's telling us we're off balance and can't process things as it normally would. The E stands for eyes, losing vision in one eye, both eyes, blurry vision, double vision, any sudden change in vision, that is going to be a possible brain-related issue and not just blurry vision because I've been staring at a new computer for the last 3 hours. Okay, so if there's no reason for a sudden change in your vision, then we want to think it could be the brain and not just the eyes. The fast is what we've known for many years. We're used to that. The facial droop, does one side look lopsided or uneven? The arm drift, is one side weaker than the other? And that could be arm or leg, anything on one side that's not balanced, a weakness. Any speech problems, slurred speech, inability to find their words, inability to speak clearly, inability to comprehend speech, any issue with that communication piece that's different for them could be a sign of a brain issue, and that could be a stroke. And the T, we've always focused the T on time because time is critical. Brain attack means brain cells are dying, damage is being done. Brain cells will not rejuvenate. So any brain cells that are permanently damaged will not be able to come back to life. So time is very important. We want to stress that calling 911 to get that patient transported rapidly is very important. However, you notice I've added an extra T down here because the T is also terrible headache. We're really trying to educate the public on that sudden onset, terrible headache with an unknown cause. And again, you're not working on a new computer for the last 3 hours and you've got a splitting headache. But that headache that comes without any reason or known cause, we want to realize that may very well be a sign of a stroke because the hemorrhagic stroke will cause that sudden horrible headache. And again, the biggest risk for that bleed is that uncontrolled blood pressure. So if you have somebody with high blood pressure who doesn't really manage it well, or maybe they didn't refill their medication last month and they've been a whole month off of their medication, and now they have that sudden onset of a terrible headache, and maybe their eyes are a little crazy or they're speaking a little slurred, that is really an emergency that we want to pay attention to, and we want to look at as if it were a possible stroke. All right, so now I'm going to jump back and we'll go into some of those risks and concerns for the stroke. So focusing on stroke, stroke is a coronary artery disease because of course it affects the arteries in the brain that are supplying the brain with blood and nutrients. So atrial fibrillation is a heart issue. So why does that matter? Well, atrial fibrillation is a fibrillation, a quivering in the heart, which doesn't allow that pumping mechanism all the time. So when there's a chamber in the heart that's doing this, blood can kind of hang out and it doesn't get pumped to the lungs or to the body like it's supposed to. So when blood is kind of hanging out there, that's when it kind of sits and it has a chance to make clots. So atrial fibrillation, and we've all seen the commercials, right? Jamul Abdul, oh gosh, I can't say his name. Anyway, we've seen the commercials, and he's a great one to talk about it because he started that lightheadedness, that dizziness. He felt really weak and tired, and they found out that he had atrial fibrillation. And we hear these stories all the time. So atrial fibrillation is a disease of the heart, but it can make those clots, which then can travel up to the brain and cause a stroke. Cholesterol is a big risk for stroke. Well, cholesterol is something that our bodies make naturally. And of course, we have an intake of cholesterol with our diets. And what's important to understand is that there is a healthy level of cholesterol, and there's good cholesterol and bad cholesterol. And what we need to do is we need to recognize that high levels of cholesterol, specifically the bad cholesterol or the LDL, is what we need to keep an eye on, our total cholesterol numbers and our LDL. If we have an LDL that's 70 or above, then we really should be treating that. So do we treat it with diet and exercise? Do we try to modify our diets a little bit? That certainly would be the first step. But if it's 70 or above, we might need medication. And depending on what other risks you have, sometimes if you have a family history of heart disease, you might be more prone to be treated with a medication earlier because your doctor wants to treat you with kid gloves. He wants to take better care of you, or she wants to take better care of you to lessen that risk. So the LDL and the total cholesterols are important numbers. And a statin is a medication that will help to lower your LDL and your total cholesterol numbers. So that's a really important thing that we can take control of with medication, diet, and exercise. Carotid Dopplers. We should ask, excuse me, our providers if we need to have a carotid Doppler. How would they know that? Well, they should be listening to your carotid arteries. Your carotid arteries are in your neck, right? And they listen to them to hear the blood flow going through because those are large vessels that supply our brain with oxygen and nutrients through the blood. Well, as we get older, we might have that plaque buildup. And you look at the pictures on the screen, you can see a healthy artery is nice and open. A partially blocked artery has some buildup inside that vessel, which will constrict the blood flow a little bit. And then you look at that plaque as it gets even more blocked, a little clot or a little piece of plaque that would normally be just floating through. Now it's going to get wedged in there and cause a complete blockage, and that can cause a stroke. So the doctor at your annual visit should be listening to your carotids to make sure that there's no constriction in that blood flow. And then if they do determine that there's a little constriction or maybe a questionable sound, then they're going to have a carotid Doppler done. And that will check and measure the blood flow in those carotid arteries to see if you have any blockage. And if so, they can go in and they can help to get that cleared out. Diabetes. I know, diabetes, you've all heard about diabetes. Everybody knows diabetes is just a tremendous disease that does a lot of damage to the body in different areas. Well, what we need to keep in mind, controlled diabetes lessens our risk for a lot of damage to our bodies, multiple systems, as opposed to uncontrolled diabetes. So what's really, really important to know is that if you have diabetes or you have a family history of diabetes, you should be having that checked on a regular basis because the earlier we can intervene, recognize prediabetes or recognize diabetes and start to manage it and control it through diet and medications, that will help to reduce your risk or at least control your risk. Okay. When we have uncontrolled diabetes, that means that not paying attention to your diet, you're still eating all the bad foods, you're using your medication because you're eating the bad foods, you're not checking your sugar as often as you should, or you're checking it and you're like, oh, that's all right. I wake up at 260 every morning. I'm fine. No, that's not okay. That increased blood sugar is doing damage to your vessels. And the inflammation and the damage that's done to those vessels makes you really at risk for stroke and heart attack and so forth. So we really want to be able to recognize if you are a diabetic that you're treating it and you're managing it, and that will help to lessen your risk. So diabetes can make you very tired, frequent urination, sudden weight loss, wounds that don't heal very well or very quickly, sexual problems, you're always hungry, blurry vision, numbness, tingling in the hands and feet, right? At that periphery, the fingers and toes, they start to, lose that sensitivity, always thirsty, vaginal infections, constantly. Those are all signs that could be related back to diabetes that you don't know about. So if you have any of these, one, you have a sudden weight loss because you've been dieting. Well, that's kind of explained, but a sudden weight loss that you can't explain, we might want to look for what that cause is. It's not always a good thing. So we want to stay away from these types of foods for diabetics. Now, it doesn't mean you can't have them. It just means that we need to do them in moderation, right? Nobody says you can't ever eat white bread or French fries again. However, those are the foods that are high in sugar, and your body doesn't process those sugars, or it processes very quickly, high sugar, and then you have that drop. We don't want that. We want a nice, steady ability for the body to process what's in there, and then we can help to reduce our sugar intakes and the sugar that our bodies have to process. So these are some of the things that we want to avoid in excess, all right? Soda, white rice, white bread, potatoes, French fries, flavored coffees, things like that. Those are the things that we want to really reduce our intake to. And you can do them as a treat once in a while, but again, you really have to pay attention to overall modification of your intake. Alcohol abuse. Well, especially this time of year, we like to have a cocktail out in the sunshine, right? Frozen cocktails by the beach. Well, drinking too much alcohol can raise your blood pressure levels, can increase your risk for stroke. Drinking too much alcohol can increase your levels of triglycerides. That's a form of fat in your blood, which can harden your arteries, increase your cholesterol levels. Women are recommended to have no more than 1 drink a day. Men should have no more than 2 drinks a day. But again, what kind of drink? Should we have the big frozen margarita or maybe a glass of red wine, right? So a glass of red wine, high in antioxidants, the body tends to like that a little better than those real sugary drinks. And certainly when we talk about diabetes and alcohol, we want to avoid those drinks with the sugar, the high content sugar in there. So we look at stroke risks. Stroke risk, this is a little scorecard that's a helpful little gauge for you, but just to keep in mind, these are some of the risks in the left column, in that blue column. Physical inactivity. Well, if you have no physical activity, you're at a high risk for stroke. If you have diabetes and you have high cholesterol and you're a smoker, of course, those things are all in the high risk category. But when we look into the cautionary category, that's the one that we really want to focus on, because these are the people that could be on the borderline of increasing their risk for stroke. So blood pressure, you're looking at, 120 to 130 over something about 80. Well, that's a little higher than what we really want people to be at right now. So the doctor may consider maybe you need to increase your exercise, or let's look at your diet and see if we can reduce some of the things that will help to increase your blood pressure. Or maybe we should get you to stop smoking and that might help to reduce your blood pressure. But they may decide to try treating you with medication. All right. Blood pressure is really going to be something that the doctors will aggressively treat if you have a family history or if you have other risks. So this is a nice little chart that we always look at to say, some of those things that are cautionary, like if you were adopted and you don't know if you have a family history of stroke and heart attack or cardiovascular disease, then we might put you in that category to be a concern and watch you a little bit more closely. So that's a little bit about trying to recognize those risks and taking better care of our bodies as a whole. So the Be Fast I introduced, we're going to go into another reminder. This is the logo that you're going to see more and more of. And again, we're transitioning this terrible headache into our time. So the Be Fast, the T is still standing for time, but we're also incorporating the terrible headache. And I can't stress that enough. So these are for those sudden changes to your balance, your eyesight, your facial appearance, droop, speech, weakness on one side, and that terrible headache with no known cause. These, any one of them by themselves, without a known cause or a reasonable explanation, may be indicating of a stroke. So it doesn't mean you need all of these things. It could be any one of them. A sudden change in your ability to stand upright and walk in a straight line. All right. Now, if you've had 6, mixed cocktails with your brunch, then there's kind of a reason for that. But when you have that sudden change, that is something that really needs to be looked at as a serious emergency so that we can get you the help that you need right away. So again, facial droop, slurred speech, dizziness, any visual disturbances, weakness, tingling, numbness, not being able to talk or speak clearly, an unsteady gait and a loss of balance or vision loss. That's what we really want you to pick up on. Any one of those could be indicating of a stroke, and that means it is definitely time to call 911. We want you to get the help that you need right away. Now, once we've treated you in the hospital, admitted you, we've done the workups, there are important follow-ups that you need to have. The physicians that will be recommended to you to follow up with, definitely your primary care physician. And also based on what we found during your evaluation or your hospital stay, it will probably include a neurologist and a cardiologist. If we found that your echocardiogram or your EKG showed anything abnormal with your heart, we're going to recommend that you make friends with a cardiologist, and we'll have you meet one in the hospital or follow up with one. And that could be for blood pressure management. If we found that you have atrial fibrillation, maybe you're going to have a loop monitor implanted for the next couple of years, or maybe just a Holter monitor for a couple of days. What we're looking for is we're looking to see if you're having any irregular cardiac rhythms that we could then manage better for you. And that's what we're going to do. And then, of course, an endocrinologist. Maybe we find out that you are pre-diabetic or that your A1C is elevated and we think that you're a diabetic and you're going to need to be seen on a regular basis by somebody to manage that. So there will be recommendations for you to follow up with the physicians, and we'll try to make sure that we help you understand the importance of those and who's important for you to follow up with. There will also be medications. I understand a lot of people don't like, trust, want, or wish for medications. However, if you're deemed to have these risks for heart disease and for stroke, then there are medications that can make your life much better, much more manageable, and your disease can be lessened in the risks for these incidents. So aspirin and Plavix are antiplatelets. So aspirin and Plavix may be prescribed for you, maybe for 30 days, maybe for longer than that. But aspirin and Plavix are going to help to keep those platelets from sliding off one another and not, bunching up together to form those clots. Then we also have anticoagulants. Now, I say that because I'm explaining the difference between an antiplatelet, such as aspirin and Plavix, an anticoagulant, such as Eliquis, warfarin, which is known as Coumadin, Xarelto. Those types of medications are so that your blood stays thin, okay? And they don't want those clots to form, not just the antiplatelets, so the platelets slide past each other, but the anticoagulants will help you from forming those clots. So if you have AFib, then an anticoagulant is the medication that puts you, that is the treatment for that. The statins we mentioned are going to be for high cholesterol levels. Insulin, metformin, those would be medications we're going to use for diabetics, okay? And there's other ones out there as well. But what's important to know is that if you're prescribed a medication for any of these or any other, heart disease or coronary artery disease, we want you to be monitoring and using them appropriately. Okay. So if you're prescribed a statin, when do we take it? We should be taking a statin at night. If you're prescribed blood pressure medication in the morning and at night, it's important that you're taking them at the same time in the morning and at night, kind of every day. All right. A one-off is okay. You missed the Thursday night because you got home late because of traffic. Understood. But as a general rule, you want to try to stay in some kind of a pattern with your medications so that your body can adjust and process those medications the same way every time. And that helps to keep that level of medication in your body much better and much more regulated. So which one are you? Okay. Are you the healthy nut with the big weight bar, or are you the couch potato with the chips and the soda? Well, we're not asking you, we're not judging you. However, if you're either one of these, we don't want to be an extreme in either one direction, right? So what do we want to do if we're eating? We want to do a healthier food pyramid, okay? So we want the base of our foods to be healthier servings of bread, cereal, pasta, vegetables, things like that. We're going to take a little bit less of the meat, the fish, the milk and yogurts and cheeses, and the less of the fats, oils, and sweets, right? So we want to have the biggest base of the foods to be the healthiest for us. And then we're going to have lesser of those things that are naughty. Now, in the summer, there are some foods that we can help to keep our bodies stay cooler. All right. So things like leafy greens, avocados, coconut, mango, lemons. So a lot of those fruits, cucumbers, melons, fish, those are things that will help us to stay a little bit cooler. They're better for your bodies. Things that have a larger, moisture content are good for us. So these are all things that help our bodies stay a little healthier in the summertime. Overall, we want to decrease our saturated fats, decrease our sweets. We don't want those things that raise our LDLs, which is that bad cholesterol. We don't want to increase those foods that lead us to the type 2 diabetes, right? All those white sugary foods, the white bread, the potatoes, and so forth. They will all increase inflammation throughout your body. So not just will we gain weight, but it increases the inflammation. And inflammation, we talk about inflammation when we talk about blood vessel disease. We talk about it with cancer. We talk about inflammation with autoimmune diseases, right? So inflammation is bad. So anything we can do to reduce that is what we want. So when we eat, we want to eat colorful. Excuse me. Looking at these pictures right here, look at the vivid colors we're looking at, and you can see bright colored foods generally going to be a healthy approach, good nutrition content, and we want to make sure we're getting our nutrients and our minerals from the foods that we're eating so that we don't have to do a lot of supplemental. Supplements will help if you've got a deficiency, but if we can increase our intake in our normal healthy eating habits, then that, of course, is what we want to do. Now, examples of cardio training. I put this in here for seniors because obviously weightlifting is great. If you can stay toned, that's great, but nobody's trying out for the Olympics right now from our audience, right? So what can we do? Playing catch with your grandchildren, going for a little walk, gardening, jazzercise, mowing the lawn, walking on a treadmill. You don't have to be outside rowing from one side of the lake to the other. But if you have any activity that you like to do, just increase it. Every little bit that you can increase is going to make you healthier. Moving more, get your heart moving more, get your whole body moving more, and anything that's going to be a cardio exercise, it's just increasing your activity level. All right. If you like golf, maybe one time a week, don't use a golf cart, okay? Whatever it is that you can increase your cardiovascular exercise, that's what we want to do. And it shouldn't be painful. Now, the strength training, again, we're not trying out for the Olympics, but strength training will help to make you stronger and fitter. It helps with your muscle mass. It helps you to lose weight. It helps you to have more flexibility. It helps with chronic disease. And exercise is healthy for the brain as well. So it will help to keep you mentally sharp and make your brain healthier. And that's what we want overall. Yoga. Yoga, anything like that. Again, it's about moving more. So keep calm and do yoga. Yoga is good for the physical fitness. It's also good for the mind and body. So it will help to keep you cool. It will help to keep you happy. It will help to keep you toned, increases your libido. So all of these things will really help. And you don't have to go out and join a yoga studio. You can get a video at home on YouTube and just do something a little bit slow and steady. Make sure that you're not doing anything crazy that will jeopardize your health. If you've got, bad joints, talk to your physician first and find out what you should be doing or what you can do. And of course, meditation. Any kind of meditation. You don't have to go to a meditation guru and figure out, there are ways to do your own level of meditation that will help to reduce stress, lower your blood pressure, lower your heart rate. Very easy, simple things that you can do. Just having a quiet corner, just having 10 minutes of a quiet room to yourself. You can do your own form of meditation just to try to relax your mind and to focus, even just breathing exercises. All of that is going to be a healthier approach to the mind and body that we want to connect with and we want to improve. So with that, we've thrown a lot at you today. We have talked about the risk of stroke. We've talked about different types of stroke. We've talked about the risks this time of year that increase our risk for stroke, knowing what risk factors we can address, what we can't necessarily change, but things that we can help modify, control, excuse me, control. And with that, I would just like to say, thank you so much for this invite here today. I am available. You can email me, you can phone call me, you can whatever you want. Thank you so much for spending your hour with us today.
Thank you so much, Lori.